My doctor told me to stop taking my birth control for just 1 week. Now I am raising twins with a genetic disorder no one knew I carried. I still remember the exact moment my gynecologist gave me the advice that would change my life forever. Take a 1-week break from your birth control pills, she said casually during my annual checkup. Your body's been on hormones for 8 years straight. Let it have a natural cycle, then start a new pack. It seemed like such simple, harmless medical advice. I was 29, happily married for 3 years, and while kids were someday in our plan, we weren't ready yet. My husband Jake was finishing his PhD, and I'd just been promoted at the marketing firm where I'd worked since college. That 1-week break turned into the 0.01% statistical anomaly they warn you about on medication pamphlets. The pregnancy test showed positive exactly 23 days later. When the ultrasound revealed twins, the technician's excited plight was met with my stunned silence. Jake squeezed my hand so hard his knuckles turned white. We were terrified but slowly adjusted to the idea of becoming instant parents of 2. The pregnancy progressed normally until the 20-week anatomy scan, where the doctor's expression changed while examining the baby's heart. I am seeing some irregularities, she said carefully. I'd like you to see a specialist. 3 appointments and countless tests. Later we received the diagnosis. Both twins had Dijorge-Inkopin, a rare genetic disorder that can cause heart defects, immune system problems, and developmental delays. The genetic counselor explained that I was an asymptomatic carrier of a chromosomal deletion, PRN, something neither I nor anyone in my family had ever known. If you'd been screened before conception, the genetic counselor said gently, you would have known about this risk, but no one had ever suggested genetic screening. It wasn't standard protocol for someone my age with no family history of disorders. The twins' parent Ellie and Sam parent were born 7 weeks premature. Their first year involved 5 surgeries between them, countless hospital stays, and medical bills that quickly exceeded $1 million despite our insurance. Jake put his academic career on hold indefinitely. I negotiated a remote position, but eventually had to step down to part-time. Yesterday marked the twins' 5th birthday. Ellie, who needed a feeding tube until she was 3, blew out her candles independently and asked for a second piece of cake in the clear, deliberate speech she's worked on with therapists since she was 18 months old. Sam, who's had 3 heart surgeries, ran circles around the yard with his cousins, only stopping when his lips started turning slightly blue, his signal that he needs rest. They are beautiful, resilient, challenging, exhausting, and absolutely loved, but I can't help wondering how different our lives would be if my doctor had added one crucial sentence to her advice that day. And if you are sexually active during that break, use backup protection, 7 words that could have completely changed our trajectory. Or if someone had suggested genetic screening before we considered having children, pair tests that would have revealed my carrier status and allowed us to make informed choices about family planning. Last month at a routine cardiology appointment for the twins, I ran into my former gynecologist in the hospital cafeteria. She didn't recognize me at first. When I reminded her who I was, her eyes widened as she looked at my twins and their matching heart assault shirts. They're from that 1-week break you suggested, I said, keeping my voice neutral. No one knew I carried Dijorge. She was speechless, then whispered, I am so sorry. I should have mentioned backup protection. I nodded. Now you will for other patients. Some medical advice seems minor in the moment but can alter lives forever. I love my children fiercely, but I wish we'd been prepared for the journey we didn't choose today. I volunteer with a genetic awareness organization helping other families navigate what we learned the hardest way possible. And whenever a friend mentions their doctor suggested a hormone break, I always add the 7 words mine forgot, because sometimes the smallest medical details change everything.